Okay, so thank you again for the kind introduction. So this is what's new in basic research in trichology, and it's actually a title inspired by um, Professor Ramon Grimalt's invitation for me to give a similar talk in Sitges last September. This one's a bit longer, so I've expanded it a bit. Just to start off with some fun facts. This is a hair community, so you probably know all these, but the highest density of hair follicles is on the tip of your nose. It's quite a useful one to talk about when you're talking to people who don't know the industry. A ponytail can bear the weight of two elephants, which just is a testament to the fact of how strong a material the hair is. And it's possible to grow 12 kilometers of scalp hair every year, which is amazing and demonstrates what a metabolic powerhouse the hair follicle is. So this is what I'll cover. So types of hair loss, some of the approved and early stage treatments, just a revisit to the hair cycle and implications and changes in hair cycle dynamics. And then three topics which have been attracting research more recently. These are hair follicle metabolism, aging of the scalp skin, and the microbiome. And I'll just touch on a little bit on what the implications are for the cosmetics, nutracosmetics, clinical industry. So, why do people lose their hair? I think if I go back about 15, 20 years, then the hormones, the genetics, and the way that the follicle responded to these was pretty much it. However, in the light of work that's been done over the last maybe 5 to 10 years, we're starting to revise this sort of picture. There are very many different types of hair loss, but the main ones that you'll come across in your clinics or whatever are these three: alopecia areata, androgenetic alopecia, and telogen effluvium. Um, as well as some of the scarring alopecias. Um, Most interesting being perhaps frontal fibrosing alopecia, which seems to have emerged as a growing incidence in recent years. So this is just a picture to show what happens with somebody who has loss of hair around the hairline. It's a very distressing condition, and currently there doesn't seem to be very much that people can do about it. So when I think about hair loss and some of the mechanisms, and we'll talk a little bit about that as I go through the talk, I've added age and lifestyle as being very much a part of the whole panoply of mechanisms that are important in the follicle, but also in hair loss and also immune disease. Because although we might think of immune-related hair loss as being limited to, say, some of the scarring alopecias and alopecia areata, actually defects in the immune system and inflammation, they're present in even simple hair loss as well. The treatment landscape is very open, even though there are limited numbers of what we might call approved drugs for hair loss. Well proven are minoxidil, which is a topical potassium channel opener, induces anagen and maximizes the percentage of growing anagen hairs. And it's recently gained a sort of second wind, so to speak, because of its use orally in lower doses. And then finasteride and dutasteride are 5-alpha reductase inhibitors, and they interfere with the androgen-dependent mechanisms that impact on hair loss. And then anti-androgens for female hair loss, things like spironolactone, are still pretty staply used by clinicians. There's less evidence, but clinical trial early stage for a number of different technologies. Quite a lot of these are to do with stem cells, um, but other ones to do with RNA interference for the androgen receptor, prostaglandin analogues, um, androgen receptor degrading, etc. And then there's a huge lot of others, less clinical data, often very well and beautifully marketed to the consumer, but often with quite a lot of misinformation attached. And these come in the forms of ingestibles, plant extracts, herbal remedies, low-level light therapy, and perhaps more recently, fractional lasers. So, for a condition of hair loss which affects probably 50% of the whole world's population, we don't have a huge number of non-surgical technologies which can be offered to the consumer. And that's why this is still a very interesting area for research.